Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. A national program for women, infants, and children, commonly known as WIC, focuses on providing nutrition and education for low to moderate income families. We're going to learn more about the program and its nutritional message from our guest, Megan Davison, from she's a WIC Supervisor from Lincoln and Lancaster County Health Department, and Phre Meh, a breastfeeding mother in the community. Let's start with Megan. Now, Megan, tell me, what is WIC?
What is WIC? I think a lot of people have heard the name WIC or are familiar with WIC, but don't necessarily know the population we serve or exactly what we do. And so, like you said, WIC is a supplemental nutrition program. So we supplement the diets of pregnant women and postpartum women, and then infants and young children. So we provide the nutritious foods, we provide nutrition education, breastfeeding education and support, and then also referrals to the numerous resources we have available here in the community. And then also referrals for medical care, dental care, those types of things. So,
now, what food does WIC provide?
So WIC provides a lot of different foods. There were big changes to the WIC food package about 6 years ago, I think in 2009. USDA made a revision to the food packages to promote healthier eating. They added some fresh fruits and vegetables to the WIC checks. And so children get $8 a month now for fresh fruits and vegetables, and women get $11 per month. We also provide whole grains, whole wheat bread, brown rice, tortillas, low-fat dairy products, lots of protein sources, eggs and peanut butter, beans, both dried beans and canned beans now for convenience. Also, our breastfeeding moms get some canned tuna and salmon. Now, the breastfeeding moms, their energy needs are obviously higher than the average woman, and so they get extra of everything.
So, in addition to the nutrition, the food sources, what else does WIC help with? What are some of the positive outcomes that you're looking for?
So there's lots of research to back up what WIC does. I think over 4 decades of research. The program's been around over 40 years. Some of the positive outcomes, so healthier births. Moms who participate in the pregnancy see a doctor earlier, oftentimes, and have more prenatal care, and thus deliver healthier babies at a healthier weight. Babies stay in there longer, aren't born as early, and then thus are healthier weights. More nutritious diets with those healthy foods that we provide. Infants and kiddos and pregnant women just get more of those essential vitamins and minerals, nutrients that they need during periods of growth with childhood and then pregnancy, growth and development. Mothers are more likely to follow recommended infant feeding practices. For example, delaying the introduction of cow's milk until 1 year, and then obviously breastfeeding. There was some research done, and between 2000 and 2012, the number of infants participating in WIC that were breastfed increased 39%. So there's been a big push, lots of education to our clients on breastfeeding and the importance of breastfeeding.
Good. Now, how does WIC promote and encourage breastfeeding?
It's a good question. We start early, so we hope to catch those moms during their pregnancy at least once each trimester is our goal, and so we start spreading the message early about the importance of breastfeeding, the differences between breast milk and formula. I think a lot of women, or just a lot of people, think that they make formula now to be exactly like breast milk, and that's not the case. And so we start early spreading that message, the differences, the benefits for both mom and baby, and hopefully this is a message that moms are hearing not only from us but from doctors and other places in the communities.
Now, Phre, let's talk to you a little bit. Now, tell me, how was breastfeeding different in your home country compared to the United States?
Well, every single mom has to breastfeed their baby in my country, but not here. And we doesn't need help to breastfeed the baby in our country, but we need help here. And I'm here to help them who speak my language currently.
Now, how do you think the community looks at breastfeeding differently here? What do they think of it differently?
It is different because we get to use formula here. Formula are available a lot here and not in my country. I can tell in 100%, 99% of mother breastfeeding their baby, only 1% use formula. And here about 99% use formula, and 1% mothers only breastfeed their baby for the whole life.
So I assume in your country that it was common to see other women breastfeed. So you would see your aunt or your sister breastfeed, so it was very normal if you wanted to do it. But people don't see that here in America, is that right?
Yes, my mom has been breastfeeding forever, and she got 5 babies.
Yes.
Yes.
So you are helping other mothers then by encouraging them, right?
Yes.
How do you help them understand why it's important to breastfeed?
I help them to understand why breastfeeding is so important to their family, because it is best for the baby, well beyond disease fighting, and protect your baby from illness.
Good. Well, thank you for doing that. That's great. Now back to Megan. Where can somebody go to learn more about breastfeeding if they live here in Lincoln?
Well, like I said, we start with our pregnant moms early in pregnancy, and so hopefully they know a lot before baby comes. We also try to visit with moms as soon as we can after delivery. That's kind of a critical time, those first few days and first few weeks of breastfeeding, and so making sure we check in with those moms early, make sure they're getting off to a good start with breastfeeding, and we can provide some basic breastfeeding education and support. 3 of our dietitians at the health department are certified lactation counselors, and so they can definitely provide some basic breastfeeding help and support. But for those more difficult problems with latch and those types of things, we definitely want to make sure they get seen by a lactation consultant at somewhere like MilkWorks. We refer them on to those helpful resources that we have here in the community. So just making sure they're getting help and support from us, their doctors, and MilkWorks.
Okay, very good. Now, where can somebody go to learn more about the WIC program?
WIC program. So we are located, our main office, and I guess number one, you can always call. If you don't know if you're eligible to receive WIC benefits, you can always give us a call. Our main number is 402-441-6200, and they can determine if you're eligible for the program. And if so, and then we can always bring you in for an appointment. I'm trying to think. I've also got more information. Our website is probably a good place to go to get more information about eligibility and the population that we serve. Our website is lincoln.ne.gov/city/health/dental/WIC. So that gets you to that gets you directly to our website. We have 2 locations in Lincoln. Our main clinic is 3140 N Street, which is just off of 31st and O. You can actually access the clinic right off of O Street. We are there Monday through Friday, 8 to 4:30. And we're open later on Thursday evenings until 6:30. And then we've got a second satellite location at 27th and Cornhusker, right next to Super Saver. We're there 4 days a week, Tuesday through Friday, 8 to 4:30. So.
Very good. Well, thank you both for coming today. Really appreciate it. When we return, we're going to learn about how to keep a baby's teeth healthy.
My name is Damon Hershey. I'm one of many people in Lincoln that rides a bike year-round. It is important for winter riding to be prepared, especially being visible. You want to have a good quality light. You want to be visible to all road users. You want to be sharing the road. You also want to remember the 3-foot passing law. That's a safety for both the cyclists as well as the motorists. And of course, if you'd like to find out more, you can visit lincoln.ne.gov.
Welcome back to Shape of the City. I'm Clover Frederick, your host. Staying healthy is more than what we eat and how we exercise. We sometimes forget about the importance of caring for our teeth, especially baby teeth. Let's learn more from our guest today, Heidi Stark, a pediatric dentist and Lincoln Lancaster Board of Health president, and Gwendy Meginnis, the Dental Health and Nutrition Services Division Manager for the Health Department. Thank you both for joining me today. Now, let's start with Heidi. Heidi, tell me, when do the baby's teeth usually erupt?
Usually, children's teeth erupt around the age of 7 months, but everyone is a little bit different, so some can be born with teeth and some children may not have teeth until they're after 1 year old.
Okay. Now, why is it important to care for an infant's baby teeth?
Well, we know from experience and from what research tells us that once you have a tooth in your mouth, it's actually possible to start having a cavity.
Okay, well, yeah, we better start taking care of it pretty soon then. By what age should the first dental visit be scheduled, and why should we do it then?
Well, hopefully most people have heard about the campaign that's been started by the American Academy of Pediatric Dentistry and the ADA, which is the American Dental Association, also the American Academy of Pediatrics. So that slogan is basically age 1 or first tooth. And the reason for that is probably twofold. Number one, so that children can be comfortable going to an office, so that if they do ever have any problems, the parents know what to expect. But then also there's a dental home so that the parents can be educated about how to prevent decay, and also in case of an emergency, they're not going to the emergency room right away, and they have a place that they can call so that they can get some help if they need it.
Now, how is a baby's diet important to their teeth health?
That's a great question. Well, children start getting cavities from the time that the first tooth erupts, and teeth can erupt very young. So what we want parents to understand is that you need to start brushing right away. A cavity develops when there's plaque on the teeth, and the plaque can host bacteria. If bacteria uses sugar from the diet, it can create acid and break the tooth down. What parents find most interesting is actually that the mother often passes the bacteria to the child. So we often will tell parents, it's very important for you to brush and floss your teeth and to not have any cavities. Because if you have a cavity and you're sharing cups or spoons or forks with your baby, then you can pass the bacteria to your child that will cause a cavity. Again, if the child has plaque on their teeth, then they get decay. A lot of parents assume, well, my child doesn't have a diet that's high in sugar because they don't get juice, they don't get pop, they don't get candy, they're too young, they might choke. But I have a sample of an example here of a young child who's only a 20-month-old baby. This child has only been breastfed, has never had a sippy cup, has not been fed with a bottle, but they have been fed table food. And this child, as you can see, has little white spots developing along the gum line. And so this child, unfortunately, has developed cavities extremely fast. These are the teeth in the front, okay? And then these are the posterior teeth. So when you talk about cavities and why are the baby teeth important, unfortunately, bacteria and the decay, it spreads, and it obviously spreads pretty quickly. And that's one of the reasons that we want people to be seeing their dentist regularly and to establish that home early on, because if they don't and they let the cavities go, not only can it be expensive and painful, and even kids can be hospitalized. Our doctors in our practice, one doctor goes to the hospital every week to take care of infants and toddlers who have so much dental treatment that they can't even handle it in the hospital. But we also want people to understand if you don't take care of the decay in a child, then that decay obviously can be transferred to the permanent teeth, and then you have problems with the permanent teeth, which also is painful. And most people can understand that a toothache means you're going to miss some school, you might miss some work. And again, that's just a real problem for people's quality of life, not to mention the long-term effects of periodontal disease and diabetes and other things that develop and create other problems with our bodies.
Okay. Now, you mentioned a dental home. Explain to me more about what that is and why it's important to establish a dental home for both the children and the family.
Well, again, it's twofold. We call it anticipatory guidance. So in other words, we have parents who come in and they have questions about why a tooth is erupting or not erupting, and so we're able to put people at ease to explain, well, it's okay, everything is a bell-shaped curve. Some children will get teeth very young, some children will get teeth very late, and also the pattern varies a little bit with eruption. We're also able to identify if children have had trauma or what to anticipate if they do fall. Or a lot of parents have questions about the gap between the baby teeth, which is often caused by the maxillary frenum, which is the upper lip attachment. Anyway, so those types of things put parents at ease when they can sit down one-on-one with a provider and find out that those are all normal things, and then we can guide them on what to expect. We also can show parents how to brush their child's teeth. Most babies are not necessarily interested in having someone hold them to brush their teeth. But we like to remind people that just like you wouldn't let a child have a dirty bottom, some babies don't like to have their diapers changed. Well, you don't want your child to have dirty teeth because, again, if their teeth are not clean, they can get cavities.
Now let's speak with Gwendy for a moment. How can lower income, uninsured, or underserved children and families access the Dental Home Initiative?
We have some great resources in our community, and I'll start with the Lancaster County Health Department because that's where I work. But we have a dental clinic on site that targets, again, low-income, uninsured children and families. It will also see children and adults on Medicaid. They can contact our clinic, and we will service their dental home as early as age 1. We do see children as early as age 1 in that clinic. For the uninsured, we work with the sliding fee scale. It takes into consideration U.S. poverty guidelines, and it takes into consideration their household income and those number of living in the household. And even though we're working with significantly reduced fees, we'll also work with payment options with those clients as well. So that's one option in our community. Another option is we have People's Health Center. It's a federally qualified health center, meaning that it's getting federal funds to serve low-income and uninsured children and adults. They also operate on a sliding fee scale, so I'd encourage people also, looking into their program as well. Another great resource we have is the University of Nebraska Medical Center College of Dentistry. It's an academic institution, and because of that, being a learning institution, training our future dentists and dental hygienists, they do offer their services for both undergraduate and graduate clinics at reduced fees. So again, a very great, valuable resource for people needing to access services on lower fees for service. We also have some grant opportunities in our community, and a lot of our agencies are partnering to make sure that we're maximizing use of our resources and referring and not duplicating services. But we have some grant opportunities, and one of those is the Community Health Endowment of Lincoln has funded a dental group. The health department coordinates that project for the community. But what it does, it enrolls private providers, including pediatric dentists. Heidi's one of those pediatric dentists participating in this program. Those dentists, we have about 23 dentists participating in that, as well as the health department, People's Health Center, and the College of Dentistry. The dentists have agreed to accept reduced fees, and the clients pay a small portion of their fee for service, and then the grant is paying a larger percentage of those fees, and that assists clients with accessing a dental home. We've already done 2 years on the grant, and we have 3 more years at least on community grant dollars. So we're fortunate to have some really great resources in this community.
Great, very good. Now, how can clients access the Dental Health Initiative?
Again, I would ask that they contact the health department. We have a dental coordinator that coordinates that project, and we can give them more information. We also have a Clinic with a Heart. That's a faith-based organization that's doing dental screenings and referral. And so if clients are going into their Tuesday evening screenings, they also work with us and People's Health Center and the College of Dentistry and the Dental Home Initiative, making the appropriate referrals too. Some clients may be accessing maybe services at the College of Dentistry or maybe seeking out but can't afford it, so the College of Dentistry is really good about, again, referring back to us and assessing those clients, their income and their eligibility. So we're really trying to match up people in the community to the right resources that match their situation.
Great, great. Thank you both for being here. I appreciate it. Now when we come back, we're going to give you some tips on how to brush your children's teeth.
What if you could add 5 years to your child's life and make your whole family healthier with simple changes? Partnership for Healthy Lincoln wants to help you and your family live longer, healthier lives. It's easier than you think. Take the dog for a walk, play more and text a little less. Swap out a soda for water once a day. Keep fruits and veggies handy for snacking. These simple changes can add 5 years to your child's life and make your whole family healthier. For more information, visit healthylincoln.org.
Hi, my name is Dr. Libby Johnson from Lincoln Pediatric Dentistry. Today with me I have Nicole and my son Mac. We are going to go through some methods today on how to brush your infant and toddler's teeth at home. I will not be wearing a mask or gloves because this will be like how you are expected to brush at home. And this is also my child. And so the first way that we're going to talk about brushing with an infant, anywhere from infant to about age 2 or 3 even, is called a knee-to-knee method for brushing. If there are 2 people at home, have the child sit on one person's lap and lay backwards into your own lap. Mac will hold Nicole's hands, and then I will take the toothbrush here, and I am able to see directly into his mouth with the overhead light, and I get direct access to really brush all the teeth good, and that way I can see what I'm doing. And then that would be the first way to brush. Another method for brushing your child's teeth, especially if there's only one of you at home, is to sit on the floor. You'll have your child sit in front of you and lay back into your lap. This way, the light is going into their mouth and you are able to see directly. It is okay if there's a few tears and they are crying. Their mouth will be open for you to be able to brush and see. The next 2 methods I'm going to show you is how to brush your child's teeth from around age 2 till around age 8 when they are ready to brush their own teeth. The first way is to have your child stand in front of you. I'm going to have Georgia stand in front of Lisa here. She's going to look up to the sky, and Lisa's going to brush her teeth that way. It is very difficult to stand in front of your child and block the light this way, but standing behind them allows the light to go into their mouth and you to see what you're doing. If your child is older and too tall to stand in front of you, you can have them sit in the chair in front of you, same way, facing the same way and looking up, and you standing behind. The second method for brushing your toddler's teeth, anywhere from age 2 to 8, would be to have them sit in front of you. You would sit crisscross applesauce on the floor. They'll lay their head back into your lap, much similar to how we did it with the infant. That way the light is going directly into their mouth and you are able to see what you're doing. Flossing is also important if there are any teeth in your child's mouth that are touching. Lay your child back similar to the way that you did while brushing. If you see any teeth that are touching, use the same method that you did for brushing to floss your child's teeth. It's also important to remember to visit your pediatric dentist or dentist every 6 months. Just remember to visit your dentist as early as the eruption of the first tooth and no later than age 1. Your dentist will be a great resource for all oral health questions you may have.
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thanks for watching. Until next time, get active, eat healthy, and stay informed.